You're watching Let's Chat.
This morning, Dr. Circolone is visiting us to introduce us to Apple Physical Medicine and Rehabilitation. So say good morning and welcome to Dr. Nick. Thanks for joining us.
Oh, so good to see you. Thank you for having me.
So tell me a little bit about your history and how you become to be the excellent doctor that you are.
Well, we actually, we've been in Chattanooga 27 years now. I'm a chiropractor. I have a fellowship in orthopedics, so I'm actually a chiropractic orthopedist. What that is after chiropractic college, I went for another 3.5 years, passed the national board, and I got a fellowship in orthopedics. So what we do in our office is more of a rehabilitation. We have an office with a medical doctor in there as well, Dr. Soldo, and myself. We do interventional knee injections, we do pain control stim units, we also do some physical therapy as well as, chiropractic, of course.
So you kind of introduced us to Apple Physical Medicine and Rehabilitation and a little bit about your services. Do you have a favorite area that you like to practice in? I always like to ask that.
Well, to be honest with you, I love practicing it all. It's one of those things, I love what I do so much that if I was able to do it for free, I would do it for free. One of the things that came into the office about a year ago was we started doing more interventional kind of modalities, such as knee injections with hyaluronic acids. And we also do PRP, which is platelet-rich plasma, where we use your own blood and inject it in there to help regenerate the knee. But we also have, I call it the flagship of our office, is the SteveX unit. And what that is a neuropain stimulator to help decrease pain. Okay. What's really cool about that, Jessica, is that 85% of the patients get 50% or better relief from chronic pain. Now, we're talking chronic pain.
Chronic, right.
Yeah, so if you've had chronic pain for years and years and years, and we give you 50%, you've done amazing.
That's changing someone's life.
It really does. So instead of sitting on the couch, now you can go do things outside because we've changed it. And the way it does it is it's implanted in the ear for 2 weeks. There's a 3-phase process to it, but the first one goes in for 2 weeks. And what we do is we stimulate the vagus nerve to increase your body's endorphins. Well, once we increase your body's endorphins, now what we're doing is we're taking away some of your opioids that you're taking. So we're not only helping you get out of pain, but we're also decreasing the amount of opioids you're taking, which is something we really want to do in this country.
The science behind it all amazes me. So who would you say is the majority of the patients and the patients that need to come see you? What kind of categories do they fit into?
Anybody with chronic pain. If you've had pain, now chronic pain is classified at 6 months or more. Well, I want to see patients that have had years of pain before we even do this. Not every patient's going to get a SteveX unit. Some patients will get it and it'll help. Some patients it doesn't. It's not a cure-all for everything, I'll be honest with you. But what happens is the patients get so much better that they don't want to take them out. But once we remove them, the level stays about the same. Sometimes it drops off. We can do them every 6 months, and what's really neat about it, most insurances cover it.
That's fantastic. All right, we're going to be talking to you again here in just a few weeks, and we're going to be able to dive into a couple other areas of your multidisciplinary practice. He's got me tongue twisting over here.
I was going to say, that's a lot of words to say, isn't it?
All right, so we're going to talk to you again here in just a few weeks, but in the meantime, how can someone get started with you?
All I have to do is call our office. It's 423-855-7376. Speak to one of my ladies that works in my office, and they'll get you taken care of.
All right, perfect. So be sure to go ahead and set up your consultation. If you have questions in the meantime, before Dr. Nick is back with us, that information is there on the screen. Again, it's Apple Physical Medicine and Rehabilitation. Dr. Nick, we'll talk to you again soon.
I appreciate it. Thank you. So nice meeting you.